SLPs. Picture this. You're about to do a clinical swallow evaluation with a new patient. You know you're going to do an oral motor exam, cranial nerve exam, take a case history, maybe do some PO trials, but did you know? Before you even start that process, there are 3 important questions you need to ask. Today we'll be diving into the 3 questions MedSLPs should ask before evaluating a patient with dysphagia. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1. Is the patient NPO and why? Oftentimes when we are consulted to see a patient, the patient is NPO, meaning it's recommended that they don't eat or drink anything. But one of the key questions we need to ask is, why is this patient NPO? Is it because the physician or the nurse was concerned about their swallowing due to their diagnosis or a witnessed coughing or choking event? Maybe they made the patient NPO until you showed up to assess their swallowing. Or is it because of a GI or surgical reason? Talk with the team and read their notes to learn their concerns before you evaluate. Pump the brakes and make sure you answer this question before proceeding. If you accidentally give PO trials to a patient who is supposed to be NPO for an emergent surgical procedure, you might completely derail their plan of care. Yikes! Also, if the patient has a diagnosis like an ileus, you don't want to provide any PO. An ileus is a temporary digestive disorder where the normal muscle contractions of the intestines are lacking. When this happens, we do not want to give the patient anything to eat or drink, simply because their GI system won't be doing the work to move it through the GI tract. These patients might be on bowel rest, IV fluid, or even have an NG tube inserted for gastric decompression. Their symptoms could include bloating, vomiting, constipation, cramps, and loss of appetite. Speaking of whether or not to give a patient food and liquids, an extra question to ask yourself is, does the patient have any food allergies? This can be easily overlooked, but the last thing you need to happen is a patient develops a severe allergic reaction to the peanut butter crackers you gave them because of a severe nut allergy. Not all patients will be able to communicate their allergies to you, like in cases of stroke, dementia, or severe TBI. So even if the patient is not NPO, still check their charts to see if there are any ingredients they cannot consume due to an allergy. This also goes for religious and cultural considerations as well. Being mindful of which foods, ingredients, even temperature of liquids to provide or avoid during clinical swallow assessments is important. Here's an example of why asking the question, is the patient NPO? And if so, why is the patient NPO before doing a swallow evaluation? 67-year-old male was admitted to the hospital with an acute right middle cerebral artery stroke. This patient was made NPO, and the SLP was consulted due to the stroke protocol at the hospital. However, this patient was also NPO for a CT angiogram of the brain plus possible embolization. When the SLP arrived to evaluate the patient, she checked the chart and realized the patient was awaiting this potentially life-saving procedure and made plans with the nurse to return for a CSE after the patient was cleared to trial PO after the procedure. Can you imagine what would have happened if the SLP hadn't answered this number 1 question? Their entire plan for embolization might have been derailed. Number 2, let's move on to the second question you should ask prior to completing a swallow assessment. Does the patient have any special precautions? In the medical setting, patients sometimes have a slew of important precautions to be aware of. For example, a patient might have precautions surrounding positioning requirements. This can include C-spine precautions, where a patient can't sit upright until their spine is shown on imaging to not have a fracture, and/or appropriate bracing is in place. The patient might be unable to sit in certain positions or comfortably upright due to recent surgeries, wounds, fractures, or other injuries. There are also drain-related precautions. One very important example of this is the presence of an external ventricular drain, or an EVD. This is one of the most common and important life-saving procedures you might see in a neuro ICU. An EVD continuously monitors intracranial pressure and diverts cerebral spinal fluid. The positioning of the patient or the EVD is critical at all times. A nurse needs to be present to manage or clamp drains and to ensure proper positioning. Nurses might even use a carpenter's level or a newly developed laser leveling device to ensure the accuracy of the placement of the ventricular drainage collection system. The intracranial fluid collection system must be re-leveled whenever the patient changes position to avoid false or inaccurate intracranial pressure readings and over or under drainage. In a nutshell, if you have a patient that has an EVD placed, it's crucial that you speak with the nurse first, so the nurse can reposition the patient and the drains appropriately in order to prevent undetected intracranial hypertension or erroneous readings. Other precautions to be aware of include helmets or other braces that are needed for upright positioning or whenever the patient is out of the bed. Depending on the patient's surgery or injury, like whether it's craniotomy, ACDF, or multiple spinal fractures, the patient may require a brace to be in place before you can work with them. And finally, are there any PO-related requirements or precautions? For example, is the patient on clear liquids only? This is common after a GI procedure or for patients with GI concerns. We can't be trialing solids with these patients. Just as I mentioned earlier, see why the patient is NPO if they are. Is it due to a concern for an esophageal leak or tracheoesophageal fistula? This is also common with GI or thoracic surgeries. We can't assess PO with these patients until cleared by surgery. In some cases, patients can be cleared for small amounts of barium, clear liquids for fees, or IsoView depending on the surgical situation and the concerns. We must work closely with the medical and surgical teams to understand precautions and what we are or aren't able to do during our evaluations. A friend of mine was once assigned a new consult for a patient with an EVD, but she had never seen or heard of this device before. She did the chart review, checked to make sure the patient didn't have any upcoming procedures or diagnoses that would prevent her from completing the bedside swallow assessment with food and liquid trials, and went into the patient's room. She couldn't find the nurse, but figured she would go ahead and start working with the patient. The patient was awake and alert, but reclined at about a 45-degree angle. The SLP and the patient spoke for a little while as my friend conducted an interview, established rapport, then it was time for the PO trials. Right as the SLP was about to elevate the head of the bed to a 90-degree angle, the nurse came flying in to stop her. She frantically explained to the SLP that she cannot elevate the head of the bed without the nurse clamping the drain and repositioning everything first. My friend was mortified and felt horrible for potentially causing harm or disrupting the intracranial pressure readings and fluid draining. It was a scary lesson and one that stuck with her forever after that. No one had ever mentioned this precaution to her before, and it's one of the reasons why I share this with you today. I know I had never heard of an EVD and positioning precautions when I first started out as an SLP. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about what to do or ask before completing your dysphagia eval? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Make sure to stick around to the end to claim a freebie or two. Number 3. Okay, let's now move on to the third question you should ask prior to completing a swallow assessment. What does the patient want? This question is key. Just a reminder, it's even part of the evidence-based triad: research, clinical expertise, and patient preferences. According to Horder and colleagues in a 2016 paper, SLPs have fiduciary and other ethical and legal obligations to patients. It is crucial that we understand how to present the patient's conditions and treatment options in an objective manner to allow the patient to make the appropriate decisions for their own care. The Patient Self-Determination Act of 1990 indicates that patients should be given written notice upon admission to the healthcare facility of their decision-making rights, and policies regarding advanced healthcare directives in their state and in the institution to which they have been admitted. Let's dig deeper into well-documented patient rights. Patient rights include the right to facilitate their own healthcare decisions, the right to accept or refuse medical treatment, the right to make an advanced healthcare directive. Prior to and during your evaluation, answer the following questions. Does the patient or designated power of attorney want a full swallow evaluation with possible video fluoroscopy or fees if recommended, to participate in rehabilitative swallow therapy, to use compensatory strategies if it will keep them safer or more comfortable with PO, to modify their diet if it will keep them safer or more comfortable with PO, nothing to do with SLP, and to eat and drink regardless of any risk of choking or aspiration. To know more about their specific risk for aspiration, choking, and/or malnutrition and dehydration, and make a decision about their plan of care later. These questions will guide your recommended dysphagia plan of care. Palliative care physicians, if available at your hospital, and goals of care discussions, often led by the medical team, are very helpful when answering these. Be sure to document informed consent after you discuss risks and benefits of your intervention with the patient and/or their medical power of attorney. Let's give another case study example. An SLP evaluates a 98-year-old patient who fell and sustained multiple C-spine fractures. The patient also has a history of end-stage cancer. The patient is drowsy and has obvious signs and symptoms of aspiration during the clinical swallow exam. The patient has an advance directive stating that he would never want a feeding tube. Although he is drowsy during your evaluation, he is able to clearly state, alongside his medical power of attorney, his daughter, that he would not want a feeding tube or any further assessment or treatment for his swallowing. His goals of care are consistent with wanting to eat, drink, and focus on being comfortable, regardless of risk, including risks of aspiration, choking, malnutrition and dehydration, and pneumonia. The SLP provides education on the options of video fluoroscopy or FEES, or swallow therapy in the future, as well as the risks and benefits of further assessment versus not proceeding with further assessment. Lastly, the SLP documents informed consent and offers her information to the family if they have any other future questions or if the patient's goals of care were to change. The SLP relays the results of her evaluation to the managing physician. In this case, the SLP doesn't need to order a video fluoroscopy or FEES to provide further follow-up care because it will not affect this patient's plan in relation to his goals of care. Remember this acronym, DOTDAM. Don't order tests that don't affect management. I've got a free gift for you over at MedSLPcollective.com. You'll get instant access to our free MedSLP Collective clipboard kit, which includes our clinical swallow examination resource and other important documents to assist you with dysphagia assessments and medical conditions. We have a robust and vibrant community of SLPs and mentors to help you out with your toughest clinical cases. Head over to MedSLPcollective.com now to get your hands on this. The link will be in the description below.